Just really briefly about new guidance the Minnesota Department of Health issued yesterday for nursing homes and other long-term care providers, essentially allowing facilities to start allowing visitors back into nursing homes on a limited basis. Now, before I get your hopes up, I want to remind you that the guidance they issued yesterday was voluntary. Nursing homes do not have to adopt an essential caregiver plan to allow family members or support persons back in to help residents. They should. If a facility is not doing that, I would strongly encourage you to contact your regional long-term care ombudsman. Caregiver guidance says that nursing homes should allow the essential caregiver to come in for up to 3 hours a day, that they should accommodate evening and weekend hours for essential caregivers that have to work or take care of their kids during the day. It also says that prior to coming in the facility, the nursing home should screen the essential caregivers for COVID symptoms, just like it would for their staff. And it also has to provide training and ensure that the essential caregivers know how to use personal protective equipment appropriate to the situation. The facility is allowed to limit the movement of the essential caregiver while they're in the facility. They're also allowed to ensure that the essential caregiver uses their personal protective equipment while they're in there, and also maintains appropriate social distancing while they're in the facility. If an essential caregiver does not do those things, a long-term care facility is allowed to prevent the essential caregiver from coming back. If the resident that the essential caregiver is coming to visit, it displays symptoms of COVID-19, the facility will notify the essential caregiver, and in that limited circumstance, it provides that the nursing home could cut off the essential caregiver from visiting except for compassionate care. And compassionate would be hospice or end-of-life care. Now, the essential caregiver guidance also says that the resident could designate more than one essential caregiver, although only one can come at a time, and the nursing home can limit how many essential caregivers are in the facility at a time. According to the guidance, an essential caregiver is a family member, advocate, friend, loved one, partner, or anyone else designated by a nursing home resident that can come in and help them. It might be helping them improve the quality of their life. It might be helping them improve the quality of their care. It might be communicating on their behalf with the nursing home staff or long-term care staff. It might be advocating and pointing out how the resident's care could improve in the nursing home. Any number of things. It might simply be taking the resident for a walk, or sitting and watching TV, or reading to the resident, singing with the resident, or just visiting with the resident. I've included a link down below to get more information from the Department of Health regarding essential caregivers. There's also a link to the AARP's guidance on how to ensure safe visits down below. I'd encourage you to subscribe, like the video, comment on the video if you didn't like it, and also take the time to hit the notification button so you're alerted as I'll be bringing you more updates and more information. Again, my name is Josh Casper, and I'm an elder law attorney in Minnesota. I appreciate you watching this video, and I look forward to bringing you more in the future.